Hello everyone, my name is Dr. Tien from IFMD Center, Vietnam, and today I'm privileged to be here to show you the result of our study on the correlation between time interval after hysteroscopic polypectomy and pregnancy outcome after frozen embryo transfer. So my presentation today were divided into 5 parts: introduction, material and methods, result, discussions, and conclusion. So basically, endometrial polyp are the benign mass with a no pathogenesis and usually found in infertile women. The current data suggests that the polyp with size above 10 to 15 mm has the negative effect on fertility. And in infertile women, hysteroscopic polypectomy usually used for remove the polyp. And current evidence shows that in the hysteroscopic polypectomy improving the natural pregnancy rate, clinical pregnancy rate after intrauterine insemination and after breast embryo transfer. But up to now, there is limited data on the optimal time from hysteroscopic polypectomy to frozen embryo transfer. So we conduct this study to answer the question whether pregnancy outcome better after delay or non-delay frozen embryo transfer after hysteroscopic polypectomy. So our study is a retrospective cohort study conducted at IFMD Center, Middle Hospital, Vietnam from January 2016 to June 2020. We include all the women undergoing IVF treatment from the age range 19 years old to 45 years old, and the women undergone hysteroscopic polypectomy before frozen embryo transfer, and they had their endometrial reparation with exogenous steroids and transfer cleavage stage of embryo. We exclude all the patient has the embryo from IVM cycle or oocyte donation cycle, and women with other uterine abnormality, including adenomyosis, biconjugate, uniconjugate uterus, submucosal fibroids, and etc. So based on the TBET, which stands for time interval from hysteroscopic polypectomy to endometrial reparation, we divided patients into 2 groups. Non-delayed frozen embryo transfer group include those underwent frozen embryo transfer in the subsequent cycle, and the remaining groups, which means the delayed frozen embryo transfer, include on the patient underwent frozen embryo transfer with a delay of more than 1 menstrual cycle. So come to the result. As you can see in the first table, the delay and non-delay group has the no significant difference in on the baseline characteristics, except the number of polyp removed and the TBET. And in the table 2, you can see in the delay group, there is the higher positive pregnancy test, higher clinical pregnancy rate, implantation rate, and ongoing pregnancy rate, and significant to the non-delay group. Using univariate and multivariate regression, we found that the woman age had a negative effect on the ongoing pregnancy rate, of course, and surprisingly, delay for frozen embryo transfer more than 1 cycle has a positive effect on the ongoing pregnancy rate. And stratify the TBET into non-delay, delay 1 cycle, 2 cycles, and delay more than 3 cycles. We found that delay 2 cycle has the higher ongoing pregnancy rate than other groups. So you can see previously there are only three studies on this topic. The first study on 2012 with the sample size only 60 cases showed that delaying IVF for below 6 versus above 6 months has no effect on implantation rate and clinical pregnancy rate, but after fresh embryo transfer. The second in the fresh embryo transfer groups 2 is the retrospective cohort study conducted in 2016 with the sample size around 487 cases, showing that delay IVF for 1, 2, or 3 menstrual periods after hysteroscopic polypectomy has no effect on clinical pregnancy or labor rate after IVF. And recently, a retrospective survey of scale with control group with the same age with the scale, and this study has around 102 case and 102 control. The result of this study showed that an interval greater than 120 days between hysteroscopic polypectomy and frozen plastic transfer has associated with decreased pregnancy rates. And so come to our study with the large sample size more than 400 cases, which show that a delay of up to 2 cycles could result in a higher ongoing pregnancy rate compared with the frozen embryo transfer immediately after polypectomy. So, our study is the first study suggests an association between TPS and the ongoing pregnancy rate after frozen embryo transfer in the woman with endometrial polyps, and the data on our study suggests that delaying up to 2 cycles could result in a higher ongoing pregnancy rate compared to frozen embryo transfer immediately after polypectomy. And I want to give a big thank to all my colleagues at Hope Research Center, Medical Hospital, to U Hospital and University of Medicine and Pharmacy at Ho Chi Minh City. And thank you very much for your attention.